Good day, I am just Daniel from BSN 111B, and today I am going to perform the complete bed bath return demonstration. A bed bath means bathing a client who is confined to bed and cannot have the physical and mental capability of self-bathing. So, a bath is the act of cleaning the body, and the purpose of this is to cleanse the body of dirt, debris, and perspiration, and to stimulate circulation. So prior to the conduct of the procedure, I have already performed hand washing. This is to protect the client and healthcare staff as well as myself from the spread of microorganisms and the illnesses that they can cause. And also I have checked the client's chart to check the diagnosis, activity chart, positioning or movement or any specific order to hygiene. So here I have prepared the equipments and materials that I will be using. A bath blanket, two towels, a washcloth, two pairs of gloves, a basin filled with warm water, body lotion, um, liquid soap, deodorant, comb, and a laundry basket. So I have already closed the door and curtains to ensure the privacy of my client and adjusted the temperature and provided an adequate lighting to ensure my client's comfort. So now I am going to introduce myself to the client and verify her identity to be sure that I am carrying out the procedure for a correct client and explain the procedure to her, thus promotes the client's cooperation and participation. Good morning, ma'am. I am Jasmine Sadanya, your student nurse for today. May I please see your wristband, please? Can you please state your name and birthday, please?
Name is Daniel, November 21, 2005.
Okay. So right now, um, today we will be doing a bed bath, which means that I have to remove your gown and wash wash your body and some of your private parts to remove the accumulated dirt and perspiration and oil in your skin. So will that be all right with you, ma'am? Okay, so I will now begin. Would you like to avoid this time?
Mm.
Yes.
Mm.
So I will now start the procedure by wearing a clean glove to reduce transmission of microorganisms. So now I have to raise the bed to a comfortable working height. So having the bed in a high position and having less effort in reaching across the bed prevents stains on my back. So I have to lower the side rails and bring the client towards the side closer to me. So ma'am, can you please move closer to this side? Okay, thank you. So now I will place the bath blanket over the top sheet and have the client hold the bath blanket in place while I am removing the top sheet under the blanket. Going to remove the client's gown but keep the bath blanket with her to maintain the privacy. So now if my client is injured or has reduced mobility, then I am going to begin removing the gown from the unaffected area. And if the client has IV tube, then I am going to remove the gown from the arm with IV first and lower the IV container, and then rehang the IV container and check for the flow rate. So ma'am, I am going to remove your gown now. So here I have a basin filled with two-thirds full of warm water, which is about 43 to 46 degrees Celsius. But I will have the client check the water if it is tolerable tolerable for her, and this is to prevent accidental burning of my client's skin. So, ma'am, can you please put your finger on this basin and check if it is tolerable for you? Okay. Is that temperature okay? Yeah. Okay. So I will now remove the pillow of my client and place a bath towel under his head so that it will be easier for me to wash his ears and neck. And also, I will place a towel over the client's chest to prevent soiling the bath blanket and to be easier to have an easy access of the towel. So, mom, do you wear any contact lenses? Okay, so now I am going to start washing your face, starting with your eyes. So I will now wash the client's eyes with water only. So first thing to do is to dump the washcloth into the warm water and wring it thoroughly. So I will now create a mitt by folding the washcloth. So with wet washcloth with no soap, I will now wipe the farther eye of the patient from inner to outer canthus using different sections of meat for each eye to reduce the infection transmission. Now, dry the eyes of the client using the towel on her chest. So, ma'am, would you like to use soap in washing your face? So I will now wash the client's forehead, cheeks, nose, neck, and ears. So since the clients prefer not to use soap, then I am not going to use soap because soap tends to dry the face more quickly. For male patient, ask the client if he wants to be shaved. And if the client is unconscious, I should wash the eye with warm water only to prevent irritation of the eye, starting from the inner canthus to the outer canthus using separate sections of the cloth for each eye. So next is if prescribed, instill an eye drop to the patient. So if there is no blink reflex, then keep the eyelid closed and place Eye patch or shield to the client's eyes. So now that I am done with this with her face, I can now proceed to the client's arm. So expose the client's forearm and place the towel lengthwise under it. So washing the far side first eliminates contaminating a clean area once it is washed. I am now going to wash my client's arm using a firm, long stroke from distal to proximal area. So this promotes circulation by increasing venous blood return. So now have the client put her arms over his head so that we can access his or her axilla. Mom, would you like to apply deodorant? So now that I am done with the far side of the client's arm, then I am now going to proceed doing the arm closer to me. So I will now proceed to washing the client's chest. So now I am going to spread the towel across the client's chest and lower the butt blanket to the umbilical area. So this is to keep the client warm while preventing unnecessary exposure of the chest. So also give special attention to the skin under the breast and any other skin folds, particularly if the client is overweight. Now for her abdomen, I am going to grab another towel and lower the butt blanket to cover the perineal area. So in washing the abdomen, I am going to keep it covered to avoid unnecessary exposure and giving special attention to bathing the umbilicus and abdominal folds. let us now proceed to the legs and feet. So in doing this, I am going to expose the far leg of the client by folding the blanket over the midline. So being careful to keep the perineum covered to promote privacy and to maintain the client's dignity. And place the towel lengthwise under the client's leg. So use firm, long strokes in washing and rinsing and drying the from ankle to knee to thigh to groin. So for the foot, make sure to bath the skin between the toes. I am now going to proceed to the other leg and do the exact same steps. So now that I am done with the anterior part of the body, I am now going to discard the water, wash clothes and gloves that I have used to replace it with the new and clean one. So I have already discarded the equipment that I have mentioned earlier, and here I have refilled the basin with warm water, and I have here a new set of gloves and a washcloth. So I will now wear the gloves. So now I am going to assist my client to a prone or side lying position so that I can wash her back. So sir, can you please raise that side of the bed? So now I'm going to place a towel lengthwise alongside the back and the buttocks while keeping the client covered with the bath blanket as much as possible. So now I'm going to start washing her back from neck to coccyx using the firm long stroke. This direction moves from clean to the most contaminated area, and paying special attention to the folds of the buttocks and anus because the skin folds near the buttocks and anus may contain fecal secretions that harbor microorganisms. So I am now going to assist my client back to a supine position and help her and help her wear the clean gown before attending to her grooming needs. So if the patient has IV tube, insert the arm with IVF first and check the drip rate to facilitate ease in dressing. So now in grooming the client's hair, I am going to put a towel's protection on the pillow in case there is a hair loss during the process of combing. So now that I am done with the procedure, I have to make sure to perform an aftercare to all the equipments that I have used, and after that, perform hand washing and document or record any significant observation. So Again, this is Jasmine Sedanya from BSN 111B. 11B. Thank you for watching.